Corticosteroids, as the name indicates, steroids, corticosteroids, and in other another word we can say a big gun. In some cases we can say a big gun, and in some cases we can say it is an the life-saving drug. Yes, in the some cases in clinical condition we can say it is an the life-saving drug, and we can also say a big gun. Let us see the objectives available uh, in our topic, uh, classification of corticosteroids. We will see the classification according to chemical nature, pharmacological activity, and the duration of action. Then we will see the clinical applications, mechanism of action, pharmacological actions, therapeutic use, side effect, and the contraindications of corticosteroids. These are the objective as per our booklet in the lectures, and this objective we will try to cover in the lecture. Uh, Corticosteroid is also called as adrenocortical steroids because the location is adrenal cortex. That's why we can say adrenocortical. That depends on the location because it is generally secreted from the adrenal cortex. We can say adrenocortical steroids, or in simple language corticosteroids. It is categorized into two main subdivisions: corticosteroids and the androgens. Corticosteroids and androgens. Now, what is the corticosteroids? These corticosteroids are also subcategorized into two classes: glucocorticoids and mineralocorticoids. As per the name of gluco, what it indicates? Gluco, we can say gluco near to glucose. Gluco near to glucose. So what does mean glucose? So glucose related to the carbohydrate, and this carbohydrate related to the metabolism. So glucocorticoids are responsible for the metabolism of the carbohydrates, proteins, lipids, and overall maintain the immune function of the body. Glucocorticoids. Now, second name, mineralocorticoids. What is mineral? Generally, in mineral, we can say hydrochloride. Mineral, we can say hydrochloride. These are the ions, sodium. So, what are these? Sodium, potassium. These are the electrolytes. So, as per the name, mineralocorticoids are the minerals. Which are the minerals? Potassium, sodium, hydrogen. These are the minerals. So, mineralocorticoids are responsible for the electrolyte balance in our body, and electrolyte balance plus when we see electrolyte, it will comes with the water molecule. So we can say electrolyte balance plus water regulating activity generally related with the mineralocorticoids. Now, in our human body, generally the cortisol, another name of cortisol is hydrocortisone. See, here is mentioned in the human body. The cortisol, or we can say hydrocortisone, is the main glucocorticoids. We can say it is a stress hormone. Yes, this cortisol or hydrocortisone is a stress hormone. When we are in the stress, suppose example, the stress of exam, there is a release of the cortisol. Hydrocortisone is the main glucocorticoids natural in our body, which is, we can say, endogenous hormone, cortisol. And aldosterone is the main mineralocorticoids, which is responsible for the electrolyte and water balance naturally. So in conclusion, we can say, in our body, the which is the natural, or we can say endogenous glucocorticoids. So in our body, the natural endogenous corticoids is glucocorticoids is cortisol or hydrocortisone, which is responsible for the maintaining the stress and overall metabolism plus immune function. If we can say, which is the natural or endogenous mineralocorticoids in our body, is aldosterone, and which is responsible for the salt and water retention in our body. So this is about the only corticosteroids, gluco and mineralo. Second one is androgens. Now, as per the androgen, in another in another language, or we can say in another word, we can say male hormone. It is male hormone, but don't let this name of male hormone be fool us, because these androgens are also available in women's. This androgen hormone is also available in women's. So we cannot say only if it is the male hormone, so it is available only in the males. But we can say the quantity of the androgen in the male is higher as compared to the women's. So main androgens are the examples of the androgens are the dehydroepiandrosterone, androstenedione, and androstenediol. These are the androgens examples chemically. When we have to write the androgens, prescribe the androgens, we cannot write the right androgen. We have to write their chemical form. So chemical forms are dehydroepiandrosterone, androstenedione, and androstenediol. Here, androstenediol is a potent estrogen. So this, from this sentence, we can say that this androgen is converted into the estrogen. Yes, and it is very important in the women. So androstenediol is a potent estrogen. Androstenedione can be converted to testosterone and estradiol in extra-adrenal tissue. Which are the extra-adrenal tissue? In the ovary, in the lipid cells, it is converted into testosterone. So if we can say now, the word androgen, which are the androgens in the human body? Yes, obviously the main are the testosterone and estrogens. Testosterones and estrogens. These are the main one. But their precursors are very important. Which are the precursors? Startup molecule. Precursors, we can say the starting molecule. Which is the starting molecule? Androstenediol for the estrogen and androstenedione for the testosterone. So we can say that androstenediol diol is converted into the estrogen, and androstenedione dione is converted into this testosterone. Here is the illustrations. Same glucocorticoids, just in that this is in the, we can say, concept or pictorial diagram. Same glucocorticoids, mineralocorticoids, and here same the androgens. Just this explanation in the pictorial form. Adrenal gland, see, if you see this figure of the kidney and the adrenal gland, here the secretions of the, these adrenal glands are responsible for the secretion of these um, glucocorticoids and the mineralocorticoids, and which is responsible for the managing the stress, tension, also important for regulating the blood pressure via kidney enzyme renin, and balancing the salt and water level via mineralocorticosteroids, or we can say mineralocorticoids. Here there is a classification of the corticosteroids according to the duration of action. Here we can say short to medium acting glucocorticoids, intermediate acting glucocorticoids, long acting glucocorticoids, and there are examples of the mineralocorticoids. So short acting, the in the short acting, the examples are the cortisol or hydrocortisone, which is natural one. And if we see the, it is having the anti-inflammatory activity 1 and the salt retaining activity 1, and it is generally required in the dose of 20 milligram, available as oral, injectable, and topical forms. Now, if you see here, the 5 activity is more as compared to 1, and these are the prednisolone, methylprednisolone, and meprednisone. These are the synthetic one, synthetic glucocorticoids, and it is having the anti-inflammatory activity of 5, means it is more than the cortisol. Intermediate acting glucocorticoids, we have triamcinolone, paramethasone, and the fluprednisolone. What is the anti-inflammatory activity? The most having with the fluprednisolone, which is higher activity with the 15 count, and paramethasone having the anti-inflammatory activity with the 10 count. Long-acting glucocorticoids are the betamethasone and dexamethasone. What is the benefits of the long-acting glucocorticoids? It act more than 24 hours, so only daily dose, one tablet is enough for the daily use, long-acting. And if we are using the intermediate acting glucocorticoids, we need 2 tablets per day. And if we are using the short acting glucocorticoids, we need 3 tablets per day. So this action is correspond to the frequency of the dose. So in the long acting glucocorticoids, betamethasone, dexamethasone, the patient need to be take only 1 tablet daily. And if we see the anti-inflammatory score, the highest score with the dexamethasone, 30 score. And betamethasone having 25 to 40 score. So these two, 30 and 40 score, having the much more anti-inflammatory activity as compared to other glucocorticosteroids, dexamethasone, betamethasone. We have mineralocorticoids. Examples are the fludrocortisone, and which is having the salt retaining value near about 250 count. plus it is having anti-inflammatory property of 10 count. And another mineralocorticoids is disoxycorticosterone acetate, which is near about having the salt retention property, 20 count. So this is the classification according to the we can say potency or according to the duration of action. So this is the equivalent dose. What is this equivalent dose? Suppose we can say uh, betamethasone only require zero point 0.6 milligram, and here cortisone or hydrocortisone require 20 milligram. So 20 milligram is equivalent to zero point 0.6 milligram. The dose, it is as per the dose. Means if we take the tablet of the betamethasone 0. 0.6 milligram is equivalent to 20 milligram of cortisol. Or we can say another example, suppose here um, the dose of the cortisol 20 milligram is equivalent to 25 milligram of cortisone, 5 milligram of prednisone, 5 milligram of prednisolone, 4 milligram of methylprednisolone, like that. So this dose is equivalent to 100% efficacy. This dose is equivalent to 100% efficacy. This is the biological T-half, and as you know that what is the biological T-half? T-half means the time required to eliminate 50% of the drug from the body, and for the short acting corticosteroid the time required to eliminate 50% of the drug from the body is 8 to 12 hours. For intermediate acting corticosteroid, the time required to eliminate 50% of the drug from the body is 12 to 36 hours. And for the long acting corticosteroids, time required to eliminate 50% of the drug from the body is 36 to 72 hours. This biological T-half is very important to decide the frequency and the dose of the drug. Cortisone and prednisone are inactive. What is the prodrug? The prodrug means we can say the drug which are inactive when it is outside. Outside from the outside means outside of the body, or in the tablet strip, or in the syrup bottle, it is inactive. But when we take the drug, suppose example, I take this cortisone in my body, the liver metabolize this cortisone to the cortisol, that is hydrocortisone, and it is active. It become active by the liver. Same, prednisone is inactive outside. It is available in the form of tablet, syrup. We can say example syrup bottle. It is inactive. But when I take this tablet of the prednisone, the liver in my body, it convert into the prednisolone. So that's why it is called prodrug. Prodrug means it is inactive outside the body. When we take, our body metabolized by the liver and converts into the active form. The kinetics of the, I will cover this kinetics. This is the kinetics means the amount of drug need to be excreted. So, okay, let us see. We will cover this kinetics and then we will go to the main pharmacological actions. Generally, kinetics, if you see here, two important points: corticosteroid binding globulin, and the remainder is free. And you know that in the pharmacology, there is two drug: the drug which bind to the plasma protein and the drug which is free. So pharmacologically, which drug is active? The pharmacologically, the free drug is active. The bound drug is inactive, is not responsible for the pharmacological effect. Okay, so drug which is free, not able to bind to the plasma protein, is considered as responsible for the pharmacological actions. But the drug which bound to the plasma protein is pharmacologically inactive. So regarding the these glucocorticoids, it binds about 90% of the circulating cortisol, and the remainder only 5 to 10% is free. And this only 5 to 10% is responsible for the pharmacological actions. And there is also one term, CBG saturation. CBG means corticosteroid binding globulin saturation. When plasma cortisol level exceeds 20 to 30 microgram per DL, DL means deciliter, means 100 ml of the blood. When plasma cortisol level is more than 20 to 30 microgram per 100 ml of the blood, the corticosteroid binding protein is saturated, and the concentration of the saturated means no place. What is saturated? No place. No place for what? No place for the corticosteroid, no place for the steroid. So if it is not able to bind to the globulin, globulin is saturated means the drug is not able to bind to the globulin. So where is the drug? The drug is free, and the concentration of this free cortisol increases rapidly. And when we know that if the free drug in the plasma is increased, it is responsible for the pharmacological activity. And if it is excess, now simple example, if only for the cortisol, we will take the one example of cortisol, only 10% drug is free and it is responsible for normal pharmacological action. Okay, but due to some conditions, due to some disease conditions, or we can say pregnancy, we can say hyperthyroidism, what happened? There is a saturation of corticosteroid binding protein, binding globulin. So what happened at that case? When the saturation is increased, the free cortisol is increased. And when the free cortisol is increased, it is responsible for the adverse effect. Please correlate this. There is maybe the MCQ for your point, exam point of view. And in the MCQ, please be think carefully about the corticosteroid binding globulin. Means if the globulin is saturated, the cortisol is not bind with the plasma protein, and what happen? It goes to the blood free, and the free drug is pharmacologically active. There is two examples here. If you see, corticosteroid binding globulin increases in the pregnancy and with estrogen administration and in hyperthyroidism. So what happened? What is this? What is this clinical importance of this corticosteroid binding protein? If the saturation is increased, means the free drug is increased, and the free drug is increased means there may be chances of the adverse effect, and we have to minimize the dose accordingly. This corticosteroid binding protein decreases in the hypothyroidism, genetic defects in the synthesis, and protein deficiency state. So at that time, the free drug may be decreased, and The pharmacological efficacy not be achieved by the normal therapeutic dose. The synthetic corticosteroids, such as dexamethasone, are largely bound to the albumin, and the cortisol is also metabolized in the liver and the excreted into the urine. This is a normal process, not a remarkable. And okay, this is a normal one. The half life of the cortisol in the circulation is 60 to 90 minutes, and it may increase in the stress, hypothyroidism, liver disease, or when the hydrocortisone is administered in the large amount. This is about the excretion. Mechanism of action of these corticosteroids. Generally, it is act by two mechanisms. The first one is delayed action, and second one is immediate action. Delayed actions are mediated by intracellular steroid receptor, and it is generally responsible by the gene transcription. So delayed action is via gene transcription, while immediate action are mediated by cell membrane bound receptor, and it is the most commonly receptor, we can say G protein coupled receptor. So it act by the, if there is immediate action, it will act by the G protein coupled receptor. As this G protein coupled receptor you already studied in the man and environment block, in the distribution, in the chapter of the distribution, G protein coupled receptor. There is two effect of the corticosteroids. We have less than a minute. If the meeting will discontinue, you can please request it to join again. We have less than a minute. The physiologic effects are the direct effects and the permissive effect. Direct effects are, just a minute. Okay.